Researchers in the UK say 25 children died from COVID in the first year of the pandemic, although the overall risk to children remains low. The findings are being considered by the UK's Vaccine Advisory Group as they debate whether to offer the jab to under 18-year-olds. The report's co-author, Dr. Elizabeth Whittaker, who's a consultant in paediatric infectious diseases at Imperial College London, says the findings offer some reassurance to parents.
So this is three papers that we've put on the preprint server today, looking at children and who's susceptible to severe disease and how big a problem it is. And the reassuring message is that actually the number of children who are susceptible to severe disease and death from COVID is even lower than we've previously suggested. So that's a really good headline news. We identified 61 children who had died and had ever had a positive swab for SARS-CoV-2. And 4 consultant paediatricians independently went through their case notes to try and explore, did they die because they had the virus, or did they have another illness and the virus was not contributing to their death? And we identified really tragically that 25 children last year died directly because of the SARS-CoV-2 virus. And of those 25 children, 6 of them were not known to have underlying health conditions, and the other 19 were known to have quite significant underlying comorbidities or life-limiting illnesses. And so the summary would be that for children with lots of comorbidities, they are at greater risk of becoming unwell with COVID.
So it looks like really reassuring news for parents then. But can any of this data be applied to the wider population?
It's mainly relevant for children. We haven't looked at older age groups, but we do know that young people in their 20s and 30s are also at lower risk, but they tend to transmit the virus a lot more. And this data is important in terms of policy. And so we've shared it with the World Health Organization, with our government here in the UK, and with the JCVI, which is the committee that decides about vaccines for children. And I think that it will be taken into consideration when we decide which population are most vulnerable and need prioritisation for vaccination first, when the JCVI decides whether or not to vaccinate children in our setting.
Well, let me ask you about that, because different countries have taken different approaches to vaccinating their children. But what do you think? What would you support?
I think it's a really complicated decision. I think the JCVI have been waiting to get all the information in one place to make a decision based on lots of different facts. And then the other thing is it indicated? And I think our data would suggest that it's not necessarily indicated for the personal health benefit of every child, but in terms of the bigger picture and the pandemic, it's having a huge impact on our children and young people, not because they get sick from the virus, but because of the mitigations and the impact on school and their emotional and social well-being. And so those factors need to be considered when that decision is made as well. And in my opinion, I don't represent anyone of this opinion, if we can be very confident about the safety of the vaccine, then it may be reasonable to consider vaccinating our adolescents if the vaccine supply is adequate.
But overall, a reassuring picture from these reports.
I think that parents can look at this data. It's incredibly detailed. We've been really fortunate to have access to really good data through the NHS, and it is very reassuring, I think, even for parents of children with comorbidities, that the risk is very low.